Hey you guys, and welcome back to my mother channel. It's been a long time, like 6 months. How have you guys been? It's been, we've been through a whirlwind on this side and this end. I have low-key missed you guys, and I have seen you guys. Your comments, I'm gonna go through all of them, I promise. It's just every day I get like a lot of notifications. I am so proud of every single one of you guys that have passed your NCLEX, and if you haven't yet, you're gonna. Just wait on it. Just keep studying, keep doing those UWorld questions. I have told you guys already in my previous videos, if you haven't watched it, here is my how I passed NCLEX in 60 questions when it was 60 questions. Is it still 60 questions? I don't know. I'm not up to date on that, but I'm here to tell you guys what I've experienced in the last, 6+ months as being a new grad nurse and give you guys the inside scoop. So let's go. First of all, let me just show you my t-shirt that I made. It says nurse all night, sleep all day, because where's my night shift crew at? If you're a night shift nurse, comment down below. Follow me on the socials. You're my best friend. So, new grad nurse, wow. It's been a rough, go around, but I think my main piece of advice is that if you already worked at a hospital and you know the people there and you're comfortable with them and you can get a job there, do it. It's the best decision I've ever made in my entire nursing career, is to get a job where I had already worked. I was a tech on my floor for almost 3 years before I became a nurse. No, I'm lying to you guys. 2 years before I became a nurse. I got to meet people on a different level, and they helped me out throughout nursing school already, like teaching me little things while I was watching as a tech. And when I became a nurse, I didn't want to go anywhere else. I wanted to be with these group of people that made me feel comfortable to ask questions. Like, you know how in nursing school, especially when you go to clinicals, you don't want to ask that nurse like, hey, like, why are you hanging like D5? Like, like little shit like that. Like, you feel nervous and like it's like someone's gonna like put you down because you're asking a really simple question. But you know what? There's no such thing as dumb questions. My preceptors, they were amazing. And like I said, I knew them on a kind of different level than if I was just pushed into a job where I didn't know a single person and somebody had to train me and I had to look up to them. Like, it would feel a lot more different, like a disconnect. But with them, I could ask them anything. And I think that really helped me grow as a nurse, because to this day, see, if you're out there watching this, she's my night shift preceptor. To this day, I still ask her questions. I mean, I'm still a new grad. My year's not over until June. Having people that you work with that you can talk to and feel comfortable with is like my main priority for anybody who's out there who is getting a new job. There is days that I go home and I'm like, oh my God, today was a horrible day. And I haven't cried yet. My one thing is that I haven't cried yet. The day that I cry coming home from work is the day that I know I felt like a complete failure. Like, I couldn't handle what was going on, but I haven't yet. I've stuck my ground. Trust me, I've had so many things. I've had COVID patients that I've had to, not code like CPR code, but like call a code on and like get them transferred to critical care because of the respiratory status was, going down. And if you guys want story times, like, let me know. Every day there's something that happens at work and that like, I'm like, wow, nursing school did help me with that. People that say nursing school is like nothing and that like didn't help you at all, I used to say that. But you know what? Nursing school is your foundation, is your base. It's like adding things on every single day from what you learn. Pay attention. I look back and I'm like, oh, I should have paid attention to that. Like, that's important. But that's why I have my resource books. I still look up to those. I still read them because every day you're learning something different. Especially, I'm a cardiac nurse, so we do a lot of cath teachings, like, angiograms and stuff like that. And it's like, I need to know exactly what to tell my patient because, and not to dog on the doctors out there, but they do talk to them. And then we have to kind of like reiterate what they had already said, because some patients they don't comprehend that first go around. They don't really like, wait, I'm getting what done? For what reason? And then they come and ask us and we're like, what did the doctor say? Like, did you not listen to what the doctor said? And like, yeah, I did, but can you just like go over it again? Like, can you go over it? Like, so we have to give that education. So really listen to what the teacher is saying in nursing school, because that's your foundation. You don't want to have to relearn that while you're a new grad nurse. You don't want to have to relearn how to hang IVs and how to do like stuff like that. Like, that's stuff that like you should have just, that's not your concern. And trust me, once you get a hang of passing meds, hanging IVs, like all that stuff, that's just second nature. Like, I don't even think about it. Like, I'm over here like priming an IV bag and I'm like, yeah, how was your weekend? Oh, really? Like, it's just focus on those little things while you're in nursing school, why they teach you that in nursing school. And then when you get to the job, that's when you start getting to that critical thinking. And trust me, a lot of critical thinking. Like, every day there's like something I'm like, okay, they're kind of complaining about this. Like, what could this be? Like, sepsis, like, you're just like, you know, this could be this could be this. And then when you're paging the doctors, you're like, I need this. Like, paging the doctors is not as scary as you guys think. Oh my goodness. I was this person. I was so scared. I was like, I don't want to page any doctors. Like, they're gonna yell at me. They're gonna think I'm stupid. No. Most of the time, like, you're with the patient 24/7. They're not. Like, I called the other day. I felt so bad calling, but I'm like, this guy's going nuts. So like I had to like get some medicine, get like, you know, order some stuff, and I'm like on the phone with her. And mind you, they're like half asleep because it's like 3 a.m, and I'm like, I need this, like this and this. I mean, they're gonna give you what you want most of the time because they trust you. There's a trust between doctors and nurses that, like, you know, both people have education that you need to like work as a team. Like, we're all a team here, especially when it comes to patient care. And it's not as scary as you think. Yeah, close in person, I'm a little more nervous because they can actually see my face and, like, you know, can't really hide my facial expression sometimes, but it's not as scary talking to doctors. What else have I kind of encountered during this time? Patient load during this time right now has been a little off just because, you know, COVID and everything. And my floor is not a COVID unit. We do get COVID patients just because we do have the negative pressure rooms that they need. Our current floor that is COVID is like our med surg floor. So we've been getting a lot of med surg patients, which is not what I'm used to. I'm used to like authorizations, like I said, ablations, pacemaker insertions, stuff like that, which I love. Oh, I love me some cardiac patients. But having this new patient population has been really challenging for me personally lately because I didn't focus on those things before, like in my first couple months as a new grad when COVID first started happening. But now I have to like look into different kinds of medications, like different uses. Medications are like sometimes it's more confusing because like a doctor prescribes a med and you're like, why do they prescribe this? Like, so you have to like look up like kind of the other uses of this medication. Oh, this also can be used for this. Oh, I didn't know that. Like, you have to think outside the box. Not every med's going to be used for its initial purpose of the medication of why they made it. That's where it gets confusing. But that's why you have resources to use. Use all of your resources. We do get like 5 patients max now, which it has its ups and downs. You know, I am very task oriented as a new grad nurse. I think most new grad nurses are, just because I feel like if I don't get a task done, then I'll get in trouble for it. But we really have to be critical thinkers. Like, this is more important is our patient than the task. But I know tasks are a part of our job as well. So it's like kind of going back and forth of like, oh, I need this for the patient. Oh, but I have to do this task like really quick. Like, can you just do this? Like, you know, you have to learn how to delegate. Oh my goodness, Bianca, what is this? You have to learn to delegate. And I think that's very hard as a new grad since I used to work as a tech. So delegating to the techs that I used to work with, I don't want to feel like I'm downgrading them, like I'm putting them below myself, because I'm not doing that. It's just, I have a heavy load and nurses have lots of things to do. Yes, it may seem sometimes that you have free time, but that free time is, you have to use that to chart, to get your other little stuff done that people don't see behind the scenes. So delegating as a new grad is a little hard. And especially like if I was at a new place, I would feel so uncomfortable delegating because I don't know the people and they might take it a wrong way. Like, oh, this person doesn't want to do her job, but it's not like that. We have things to do, and those little tasks that take me to the bathroom. If I'm in the room, yes, I'm gonna take them to the bathroom. Why am I gonna be like, hey, can you please read? No, but it's like, hey, I'm passing a med and somebody's calling me over there. Like, hey, can you just mind getting that call light for me? Like, just let me know, call me what they need, and I'll go in there once I'm done here. Things that we have to get used to as nurses. But yeah, delegating is not my favorite thing to do. As a tech, I'd never want to ask for help either. So like, that's just me. That's me as a person, I guess. Like, I just don't like asking for help, but you need to. And I want you guys to understand that. You may want to do everything by yourself and think that you got it, and you probably do. I mean, you might, but ask for help. You don't want to make a wrong choice just because you didn't ask for help, or hurt yourself because you didn't ask for help. But yeah, so this is the end of this part of this video. Hopefully this gives you an insight of my life these last couple months. Part 2 will be coming up soon. Thank you guys so much for watching. I missed you guys. As you can tell, I'm like so much more comfortable with the camera now because y'all my friends. Shit. I've met so many of you guys through this platform and on Instagram. If you don't follow me on Instagram already, open that back up, so I'll post it right here. And yeah, so I'll see you guys in the next video. Bye.